The next session is a guest lecture by Dr. N. Subramaniam from Apollo, Current Concepts in Male Infertility. I'll request Dr. Ramesh Datta to please keep sitting on the dais, chair this session. I'm expecting Dr. Kaberi Banerjee. Has she come here? Kaberi? She will join you as a moderator. And Dr. Anup Gupta, has he come here? Abhi nahi aaye. Male infertility pe wo karo. The current concept in the management of male infertility. This session also has you might have been given a quiz. A quiz आपके पास में होगा. इस लेक्चर में सुनने के बाद में आपको 5 सवालों के जवाब देने होंगे और उसमें से there will be lucky drip and you can win a color TV out of that. So please be attentive in that lecture. I invite Dr. Subramaniam to come here and request Dr. Ramesh Datta to start.
I invite Dr. Subramaniam to start the session.
Good afternoon, Chairman. Thank you. Friends, I wish to begin by thanking the organizers and Dr. K.K. Agarwal for the opportunity to participate this afternoon. My brief is to discuss the basic outlines of male infertility and the current concepts on that. So we know that approximately about 1 in 6 or 10 to 17% of all couples at some time would experience a difficulty, either primary or secondary subfertility. Of greater interest over the years has been the potentially correctable causes, lifestyle factors, genetic causes, etc. Now, there is a growing body of scientific evidence today that the sperm counts and the motility have declined over the last 5 decades. One of the largest studies which looked at many of the published data on about 15,000 people showed that between 1938 and 91, the mean sperm density had dropped by nearly 50%. It is a matter of concern that the seminal volumes had also dropped during the same period, which indicates a close to 60% drop in the sperm production in the current man compared to 50 years ago. Now, with these factors, we need to see how we're going to help this problem. So the first question would be, what are the causes? Because like with most conditions, we need to address the causes if we are going to find solutions to them. Dr. Agarwal has very cleverly done this quiz thing because, post-lunch infertility sessions with Subramaniam speaking, it's difficult to stay awake. But please do try. Now, when you look at the incidence of infertility based on the causes, the clever way of saying we do not know what's going on is to say idiopathic infertility, which seems to be the most common cause, whereby we do not have an identifiable abnormality. That constitutes the largest number. Varicocele, urogenital infections, immunological factors, congenital abnormalities, endocrine disturbances, they all contribute in one way or the other. And as you can see, different studies would probably even give you different data. But the basic thing still remains that the vast majority would be the incidental discovery without any specific underlying cause. Now, when you look at all these people, the first test that we all do is a semen analysis, and what we find is there is a lesser number of sperms with less motility and more abnormal forms, or the idiopathic oligoastenospermic and teratospermic condition. This is seen in as many as 40 to 75% of the people who are infertile. And over the years, various studies have been done, and it would appear that the most common reason for idiopathic infertility as we know it today would perhaps be damage to the sperm due to the free radicals. Genetic causes are important from two aspects. One, because once we understood which are the genetic causes, we may be able to find solutions. Secondly, with greater success in the assisted reproductive technologies, we need to be sure that we do not transmit conditions which may otherwise we might incidentally do. Two of the important factors, particularly in males with non-obstructive oligospermia or non-obstructive azoospermia, is this condition called Y chromosome microdeletion. The so-called azoospermia factor gene, which might undergo deletion in certain segments, is important to recognize, and serologically it's currently easy to pick up. The importance is because when you take the sperm from this male for an ICSI IVF, there is a potential to transmit the same abnormality to a male offspring. So this is important. Similarly, when we look at the various genetic abnormalities, it's also important to realize that the total abnormalities would be about 1 in 20 or about 5.8%, out of which 4.2% would be due to sex chromosomal disorders and about 1.5% are autosomal. Klinefelters being the most commonly associated sex chromosome abnormality. Cystic fibrosis is a serious condition, and it's a autosomal recessive disorders and is often associated with azoospermia. This basically is a defect genetically in the development of the ejaculatory duct, the seminal vesicles, vas deferens, and distal two-thirds of the epididymis. So anybody who opts for assisted reproductive technologies, particularly with the ICSI IVF, we need to, number one, understand the genetic potential, two, counsel them about the various tests that are available, and three, make it mandatory for couples so that we do not become a party to creating problems. The various environmental causes which over the years have been looked at include infection, excessive heat, radiation exposure, cigarette smoking, pesticides and other chemicals have all been looked at. Now, obstructive azoospermia is a condition where we find that on a semen analysis you do not find sperms, and yet when you evaluate the testes there is a production of sperms. Obstructive azoospermia, which could be either primary or secondary. The importance of this is more surgical and probably becoming less important in today's world, where we have good successes with the ICSI IVF techniques, and we have various methods of obtaining sperms through various surgical techniques. The most common one which we use today, we went through various techniques including the microscopic and percutaneous sperm aspirations, but today we find a straight and simple testicular sperm extraction works extremely well for ICSI IVF. Varicocele is sometimes one of those factors which has been talked about, and there have been questions, what does the varicocele do? It could be due to a failure, it induces a failure of testicular growth, symptoms of pain and discomfort might be there, associated infertility,